We're going to talk about something else now, which is waiting lists and deaths because of waiting lists in the National Health Service. Now, you've crunched data and you've estimated that there are over 120,000 people who have died in the last year waiting for NHS treatment. Why is that happening?
That's right. It's people who have died after 18 weeks of waiting. So you're supposed to not wait any longer than 18 weeks before getting treatment. And those people who've waited for more than 18 weeks. So it's even a bigger number if you take it for those who are on the waiting list right from the start. The NHS Constitution says that you have a right to see a doctor within 18 weeks, and that isn't happening. And people are dying in pain and fear, hoping that there's going to be help coming, and that help doesn't come. Now, the NHS was not behaving like this when there was a Labour government. I'm sorry to say this, but it is the truth. Over the last 13 years, we have seen the way in which the NHS has been diminished under this Conservative government, and they have no plan for doing anything about it. It may be one of Rishi Sunak's priorities, getting rid of the waiting lists, but, you know, the waiting lists have gone up by 600,000 since Rishi Sunak became Prime Minister. So this isn't going well. And it does seem to me that when you ask him what it is that he's going to do, all he does is blame the doctors who are on strike. But we have seen from these statistics that these waiting lists have been getting worse and worse over the last 5 years. And he cannot simply blame doctors for going on strike for a few weeks. It has been going on for years and years, and they do not have a plan to do anything about it.
Yeah, I mean, the small matter of a pandemic in there, of course, will have had an impact. And when you say going on strike for a few weeks, we know the knock-on that it's had in terms of delayed operations and cancelled appointments, and I'm just intrigued as to how Labour would have handled either of those differently, because of course Labour was supportive of the government during the pandemic, and would you have paid 35%, which is what the doctors were asking? How would you have resolved the industrial action? Traditionally you're on the side of the unions, aren't you?
Traditionally, we're on the side of making sure that public services work. And I'll tell you what, we are most definitely on the side of the National Health Service, who are made up by the people who work in it.
So how are you going to bring the waiting list down? We would have talked
to them from the outset. So the way we're going to bring the waiting list down is first... OK, all right, let me tell you. So first of all, we're going to increase the number of doctors and nurses, and we have a plan for that, and we also have a plan for paying for it. We're going to close the loophole which still exists, that allows people who are non-dom, who are from abroad, who live in this country, who don't pay any taxes. So we're going to get rid of that,
just
and
to
that
be clear,
will raise the sort of money that is needed.
They earn in this country. They just don't earn. They don't pay the tax on their money that they hold overseas. But that, anyway, carry on.
But it's a very large amount of money, and it is a sufficient amount of money to be able to pay the number of doctors and nurses that are needed in order to be able to get the National Health Service back off its knees, for example. We would use the private sector where there is surplus capacity in the private sector and where people are waiting for far too long in the public sector to get treatment. So if you need to have your hip replaced and there's a massive great waiting list in the local hospital, but there's a private hospital that has spare beds, we will send people to the private hospitals to make sure that they are treated, because the most important thing is that people are looked after. So we would do that. So we increase the number of doctors and nurses. We start using the private sector when necessary. We build up the capacity in the National Health Service. We make sure that we look again at the causes of people being ill. So we make sure that we are supporting people properly in their homes so they don't end up going into hospital earlier than they need to, by falling because there isn't sufficient social care. We make sure that we look after people coming out of hospital. We make sure that we prioritise mental health, because the connection between people's mental health and people's physical health
get the message,
really
Emily.
clear.
Emily, we're way out of time. Got to say thank you.
That's all right, Eamon. Invite me back and I'll tell you the rest of the plan.
OK. Always welcome. You know that. That's Shadow Attorney General Emily Thornberry there.